Hello, lovely people. Jacqueline Byrne, the clinical psychotherapist specialized in eating disorder, is back. How are you doing, Jacqueline?
I'm doing really well, Claudia. How are you going?
I am doing fantastic. And by the way, for all the new people on this channel or on this group that don't know me, I am Claudia Vidor, founder of the Recover from HA Support Group and the Period Comeback Program. And I am a nutrition and dietetic clinician by trade. Today, we're going to touch upon a very sensitive topic, and lots of women and lots of people in general have so many questions in regards to that. Is it possible to recover when suffering from food intolerances and food disturbances, like being celiac or being really intolerant to dairy, or simply when finding ourselves in a position where we cannot digest the food no matter what we try? Jacqueline and I have been seeing this issue impacting the recovery journey of many of the clients that we have been working with. So Jacqueline, would you like to start and let us know what you think about this topic and if it has come up in your clinical practice?
It can be such a controversial conversation, and historically in treatment, the idea of intolerances or someone with an eating disorder finding it difficult to eat food in ways that weren't just understood psychologically has been, but there's been skepticism around that. And I've always felt in my experience as a clinician that we would better service people in treatment by opening up that conversation with more understanding and curiosity and appreciating, which I'm sure you would be able to speak to and describe more clinically from a dietetic perspective, how whether it is disturbed eating and malnourishment itself that creates some of the disrupted digestive experiences people have, or a pre-standing experience. I know it's not an uncommon backstory at all for people that come to see me to have had a situation where they started to need to avoid a particular type of food or experienced gastric pain or something uncomfortable that heightened their awareness about food, and their ultimate disordered eating maybe began from those points where food started not being safe from that premise, and maybe became like other additional anxiety grew from there. So I think it's incredibly relevant, and I'm so grateful for having this time to hopefully offer the community a bit more traction on where to go if this is you.
Yeah, sometimes it's really difficult to discern what started first, so the eating disorder or the food intolerance, because as we know, there is a phenomenon which is called gastroparesis, which is normally seen in women that have been malnourished for a very long period of time. So just for everyone to have a clear understanding of what gastroparesis is delayed gastric emptying. So our ability, the stomach ability to digest the food within the normal couple of hours is normally impaired in women suffering from an eating disorder. And it's not only that, after many years of malnourishment or disorder behaviors around food and training, and after many years also sleep deprivation and heightened anxiety, we notice that the salivary enzymes, they decrease with age, stress, malnourishment, and also the digestive enzymes and the level of hydrochloric acids. So if we look at the digestion, which normally starts from the mouth, and we take into consideration that salivation is impaired, then the food goes down, the digestive enzymes, they don't work as properly, the hydrochloric acids is not in the right amount. So the food keeps going down, but it's not completely broken down and absorbed as it should be. And then it sits on the stomach for 4 to 5 hours instead of 2. And that can cause the bloating, the feeling of fullness. And then big bits of food can actually get stuck inside our body for a very long period of time. Not to mention that constipation comes really in the picture, especially for people that have not nourished themselves quite consistently over the past few years. It's very normal in that situation to witness food intolerances, and also not only food intolerances, but also the lack of trust in our body when it comes the time to digest food. Because one thing is knowing that we need to eat the food. The other thing is feeling safe and willing to work through this very hard chapter of recovery. And which is potentially one of the reasons why it's so difficult to recover. Let's say that you've been trying to stay away from alcohol and drugs for a short period of time. You will notice within a couple of weeks major improvements in your life. When it comes to an eating disorder, it's not exactly like that, because the first couple of months are possibly the toughest, also from a structural and physical standpoint. Have you seen that happening? Have you seen women suffering from these symptoms, the constant bloating, the feeling of fullness, the fear of trying specific foods?
Oh, absolutely. And thank you for walking through that process. I think that's going to be so useful. It makes complete sense when you hear it explained physiologically, and then translating that into the context of heightened anxiety or maybe an eating disorder of the lens of how that's then interpreted. You can see how much confusion, how much potential misdiagnosis, misunderstanding is ripe within that scenario. And it's something so many people go through that I've walked with in this process to recovery, that there's a phrase that getting better feels worse when it comes to eating disorder recovery. Like you were saying, with drug and alcohol, or even something like anxiety, usually getting better feels better. That as anxiety starts to decrease, you get the rewards of that. And then you develop this counter threshold because of the energy that you're saving for not being immersed maybe in substances, not being immersed in anxiety, that you can give back to perpetuate ongoing results in recovery. Whereas when you start to change how you're eating for recovery, and then you start to feel pretty dreadful potentially in your system physiologically, psychologically, that's so much harder on you as well. And then the actual meaning of how you're changing eating and body changes that you're noticing, things like bloating, can be so triggering. So it's just this really cruel, it feels cruel, combination of factors that make eating disorder recovery so incredibly difficult. And I really appreciated that you brought up the word trust with your body, because I think this is where it's really tricky as well, that if the world around you and maybe practitioners that aren't specializing in eating disorders, well-meaning loved ones around you are saying, you'll feel better. Like if you eat more, if you gain weight, if you nourish yourself better, that's going to make you better. You're going to get results from that. But your lived experience is the opposite, that you put that advice into play and your body feels like it's screaming at you to stop, and you really did feel better prior to that, and you really do feel better if you reduce what you're eating again. It creates this very confusing feedback loop. And that's where, I think sometimes if recovery is built up too much as a panacea, people also tend to believe they're doing it wrong, because how could something that's meant to be good for them feel like this? So it feels like it's the treatment that's making you sick.
And it's horrible to say, but if you're feeling discomfort in the first few months of recovery, that's possibly a total sign that you're doing it correctly, which is why working in combination with a nutritionist and a psychologist could be so helpful. Because from a nutritional standpoint, I can always have a look at the diet and understand if there is a real food intolerance or if there is anything else at play. Also, let's take into consideration caffeine in terms of talking about anxiety and digestive disruptors. And normally caffeine is really, is consumed in high amount in women going through eating disorders. So let's have a look at your dietary kind of thing. Let's have a look at the supplements that you're taking. Let's have a proper conversation of when do you experience the discomfort? Is that after eating, before eating, or it's while you're chewing the food? Because these three things can tell us a lot about how where your body is perceiving the food as a threat. And then ultimately, if there is possibly a proper intolerances, let's do the testing. There are appropriate testing that can be done to really find out what you are dealing with, what a person is dealing with. At the same time, if someone has been malnourished for many, many years, it's very likely that they are gonna suffer from food intolerances simply because the gut microbiome has been stripped by all the good bacteria and all the good fungi for so many years. And it takes a while to grow a garden. Like if you look outside and you look at your beautiful garden, it didn't take only a couple of days to grow roses. That's something that you had to plant last year. And then you had to wait for 1 full year, and hopefully the right amount of rain and the right amount of sun came into place. And then the roses are gonna bloom. Same thing with our gut. So if it has been a dysbiotic gut for years, it's gonna take a while to get back to, to get back to feeling good, basically. And then there is the psychological component, the trauma around experiencing the discomfort. And that's why you, Jacqueline, really shine. So how would you approach a woman that is actually terrified about eating foods because she's afraid of the consequences?
I think that word trust again has such a big role to play, and maybe in the whole experience of disordered eating and eating disorder. Trust is such a key word. I think when I was thinking about how to best discuss this today to bring the most value to our listeners in appreciating these different components at play, how do you discern what's more psychological and what's more physiological? And because of the interplay that we've talked about so far, sometimes that's impossible, or it's impossible to know 100% with clarity. Did you react to that because you became so anxious about it, or because you've had physiological damage from an eating disorder, but if you keep eating it, it will improve, versus there is a freestanding, or regardless, there's a separate medical situation happening? And one of the things that feels very true to me is that if we're coming from a place of alignment to recovery, it asks of us a tolerance to the unknown, to walking through the grey area and experimenting, and that what is true will continue to be true. So if we move forward assuming that, or maybe leaning into it being something that might heal with continued exposure and dietetic support, working with someone like you, then we can reassess in time. So 6 months down the track, whenever an expert like you would suggest is the right amount of time, we can reassess that. And if you were to say, well, after this amount of time, I would be expecting it to be different, let's either explore other factors or begin to understand it more as an intolerance. And then looking at the other parts of normalizing eating, such as regular eating, variety of foods, eating socially, eating with joy. If there were intolerances from whatever origins at play, those things are still really accessible. We can still engage with as much variety as is within our remit. We can still eat socially, we can eat regularly, we can eat adequately. If those things are starting or continuing to be difficult, it might also suggest or just bring to our awareness that the psychological component is still very much activated, and attending to that with care. But I think there's what I was hinting at earlier with that, like, I don't think we do ourselves or anyone else favors. Sometimes with our urgency to beckon somebody into recovery, we do such a good sales job that when people engage in that process, it inevitably feels like a letdown. It inevitably feels like they're doing it wrong. So being really clear, like you were saying, it's kind of meant to feel like this. It's kind of how you know you're doing it right. And if that was the case for too much time, then we would look into other things. But it's going to be a physiological transition.
Yeah, and word of caution: it's very normal, especially when suffering from this gastric issues, to go and see a GP or a naturopath or other medical practitioners and to be put on a low FODMAP diet just to rule out food intolerances. In the long term, even in the short term, a low FODMAP diet can really impact someone's well-being, especially if that someone is already suffering from a current eating disorder. So just a word, be mindful of the information that you trust and the people that you trust, because if you're working with someone that is not, doesn't know much about eating disorder, that can be a very slippery slope. Because if you really want to start feeling better, if you want to get rid of the digestive complaint, we need to introduce more food and a bigger variety, not less of that. And at the same time, it's very important to work on calming the nervous system, especially around meal times and also throughout the day in general. So always coming back to ourselves and telling ourselves words of trust, words of kindness before sitting down while having the meal, and simply, you know, going through all the affirmations and all the affirmations that you can come up with at any given time. When you sit down in front of that food that's been triggering for such a long time and that feels so scary as well. And I'm wondering, Jacqueline, which kind of words or which kind of thought process would you recommend women or people in general to go through when they're experiencing this discomfort and this fear when having regular meals?
Definitely normalizing it. And I think that can be confusing too, because like so much about eating disorders, it can be normalized in our culture in a way that's unhelpful, like so that there may not be alarm bells that go off with their local naturopath or GP and you're put on a protocol that's actually more harmful to you. But understanding it within the context of eating disorder recovery being a really normal part of what we'd expect in that process. The second would be to almost have a part of yourself, like a future self, speaking back to you about what this process means longer term. With anything that's uncomfortable, we are geared to avoid discomfort. So it probably would be a more pleasant day tomorrow if you went back to how you were eating and stopped trying to push through with new foods and more variety, etc. But where does that position you in 12 months, 18 months time? So being able to see this as a bridge into getting to other goals. And there's a phenomenon with disordered eating, sometimes called the unicorn complex, which is a lot of us that go through this feel like, I think my body is just a bit different. Like even unconsciously, there's like, my body will be the body that never stops gaining weight, or my body must be the one that recommendations aren't quite appropriate for, or I would want all these things for everyone else, but I'm not sure that is relevant for me. Even if we don't think about it quite that literally, that's sort of what our behavior and our emotionality suggests. So a little bit of calling that out within ourselves, and that word trust again, with knowing that if this is recommended and if this is the terrain that most people in recovery have to traverse, it is a pretty safe thing to be investing in, at least with what you know now. And if what is true will remain true. So if there's anything else that needs to be known, then that will emerge, and that will be able to course correct when that information is available. But with what you know now, recovering in this way is the safest way to go forward, and it has served many, many people before you.
Yeah, and I do believe that to a certain extent we are all unicorns, because we all need a different approach, a psychological and nutritional approach, but at the same time we are all able to recover and we are all able to heal, because that's what our body wants. Our body doesn't want to stay in a stage of discomfort for too long, and will always try to perfect itself to a place of non-discomfort. So in terms of being a unicorn when it comes to taking supplements and trying different foods and journaling opposed to doing yoga or meditating, yes, absolutely. But generally speaking, we're not unicorns. We're not unicorns. Recovery works. Now, Jacqueline, I would like to touch base on something that is very similar, yet slightly different. What if we're dealing with someone that has a real intolerance or is, for example, celiac, so has to follow a very strict gluten-free diet. How would you approach that situation?
Yeah, I love this question because I think when we talk about intuitive eating and we talk about recovery, we tend to amplify the body-led component because most of the eating disorder experience was cognitive, it was mind-led. We've divorced ourselves from our bodies, so that naturally becomes something we want to really bring our energy to. But in situations like this, it really highlights that intuitive eating and recovery is a marriage between the mind and the body. It's those two things working together so that the information you have is still part of self-love and regard for your body and facilitating a way of eating that's intuitive for you because your cognitive knowledge is part of your body, it's part of yourself. And so to me, it would be quite practically appreciating where those limitations are, and that has to be upheld as a protocol that's so protective for you, and expanding into variety and adaptability and innovation and social eating as much as that can be possible elsewhere.
Yeah. And if you look at our primitive brain, so we're talking about thousands of years ago, we always hunt and look for food that didn't contain any poison. So we inherently knew which kind of mushrooms were the right mushrooms to pick and to have for dinner, for example. And we would stay away from mushrooms that could make us feel very sick or could lead us to die. And for someone that is suffering from a real gluten intolerance or that is a gluten allergy and it's celiac, all of a sudden gluten becomes that poisonous mushroom. So once again, being intuitive is also about finding a way to complement your body needs. And I believe that someone can completely and fully recover from an eating disorder, even if there are some dietary restrictions. It always depends on how a person is perceiving recovery, because I think that that's what can hold someone's back. What do you think about people that approach you with that kind of food restrictions and they keep telling themselves, I cannot recover because this is happening in my life? What would be the narrative that you will have around that?
I would very much reiterate that complete recovery is absolutely possible, because while there might be a dietetic limitation, there doesn't have to be a psychological limitation around that. And eating disorders are a mental illness. So that's the mental health part that defines whether or not it's still relevant. So you can absolutely completely recover if there's allergies or intolerances. And we become really clear that that's what they are at play. I think the narratives that would be most helpful around perceiving that would be in looking at the quality of how you engage with the options you have, and the sense of celebration in food, and joyfully adapting where you can and becoming creative with that, and absolutely getting resources around that. Say if you're a celiac and it just practically is harder to go to some restaurants or go to people's houses for dinner, and there's a component of that, absolutely, that's just logistical. Supporting yourself and staying in that sort of celebratory, adaptive place as much as possible, and that there is so much more that you can enjoy than what you can't. There's so much more that can be had than what cannot be had. And I love what you said about how we're primed to avoid harming ourselves. And if we see it as that, like, this is this incredible, how amazing that my body can tell me what is not safe for it, and I can heed to that, and I can uphold that, and just embrace everything that is, rather than seeing it as like a restriction in itself.
Exactly. So to sum it up, first of all, it's really important to understand what is going on someone's specific situation. Is it an intolerance? Is it an allergy? Is it gut dysbiosis? Is it gastroparesis? What is it? And if you're watching us today, or if you are listening to this video on replay, always be mindful to not self-diagnose yourself. Otherwise, it's a slippery slope and it's a very long journey ahead of you. Just speak to a professional that understands what you're talking about, and it's going to be so much easier for you to make progress if you stick to the protocol. So step number 1, identify what is really going on. Step number 2, find the right dietary supports and also nutritional supports that can take you to the next level and can help you through the discomfort. And thirdly, and is last but not least kind of thing, psychological support all the way through, because there are going to be lots of ups and downs from day one. And it's really important not only to feel supported from a mental standpoint, but it's also crucial to understand how to speak to ourselves while going through this journey. Because as Jacqueline and I mentioned for the past half an hour, things are going to come up, challenges are going to arise. And if you try and do this on your own, it can be quite tricky. If instead you allow people to support you, then you're going to find ways to work around the hurdles, and you're going to find ways to improve in no time. And any words of wisdom to share with us, Jacqueline?
I think you summed that up so beautifully, Claudia. And I think all I'd add is just know that it's meant to be difficult. So yeah, that first phase at least is meant to be uncomfortable physically, mentally. That's a good sign you're on the right track.
Yeah, and we don't want to sound like the Debbie Downers of the situation. But the reality is that it's possibly the most difficult things that you can do in life, and it's at the same time the most rewarding. I've done tough things in life. Nothing has been as tough as recovering from an eating disorder. And you know, both you and I, we became moms. We built our own businesses. We had to face difficulties like everyone, hello COVID, and lockdowns. And yet we can possibly say that recovering from it was the most difficult and most rewarding things that we have ever done.
Hands down.
Absolutely. So I will see you for our next show of the Jacqueline and Claudia. And thank you for all of you that are watching us. You can find us by clicking on the link below. And Jacqueline Byrne from a clinical psychotherapist from Wings and Quills, and Claudia Vidor from Nourished by Claudia. Thanks so much, and bye everyone.